First of all, I would like to thank my dearest brother, mentor and role model, Professor Walaa Abdelhamed for his kind invitation. I congratulate Professor Basim for the great success of the conference. Many thank yous for the organizing committee for the great reception and organizing extreme. My lecture today, oral ulcer, when to refer the case. Actually, oral ulcer is a common hot debate between a lot of specialty, between dentists, rheumatologists, dermatologists, and us as gastroenterologists. The first part of the lecture هتعلم من حضراتكم is just specified approach to case of oral ulcer. The second part, I just highlight some issue when we suspect. Ulcers and erosion are common manifestation of a spectrum of condition resulting from trauma, infection, neoplasia, autoimmune diseases, nutritional deficiencies, drug reaction, and it represents a diagnostic challenge despite the oral ulcer may appear similar to all of us. For example, the anal solitary ulceration may result from trauma or infection similar to squamous cell carcinoma, which typically presented as solitary ulcer. Being solitary or multiple, have been a lot of classification has been established to oral ulcers. I would like to define some definitions as acute ulceration less than 2 weeks, chronic ulcerations more than 2 weeks. This is primary or secondary, or we mean that recurrent periods of ulceration with intermittent healing. If this patient have solitary, one single lesion or multiple. This is diagram, the acute ulceration. We begin with traumatic ulcer, necrotizing cell metaplasia, or multiple, which is the category of infection. If it's herpes simplex, herpes zoster, Kawasaki, ecovirus, parvovirus, oral sensitivity reaction, chemotherapy, while chronic ulceration is a long-standing traumatic ulcers, eosinophilia, squamous cell carcinoma, cytomegalovirus, and Gammatas disease when fungal infection. If chronic multiple ulceration, bullous vestibular disease, pemphigus vulgaris, mucous membrane pemphigoid, bullous pemphigoid, lichen planus with IgA disease, and recurrent ulceration, recurrent upset stomatitis, recurrent herpes stomatitis, and cyclic neutropenia, Behçet disease. In fact, we should encourage all physicians and residents in our institution to take accurate diagnosis. Always in oral ulcer, the diagnosis is a history taking is underemphasized. So detailed history of the present illness is very important. I would like to ask the patient if this acute or chronic about the duration of the ulcers, the past history of similar lesion, is it painful or painless, is it single or multiple? A complete review of system would be obtained for each patient. Question regarding the presence of skin, joint, eye, genital, and rectal lesion. Question symptom of disease associated with oral lesion with special consideration of the sexual history, drug intake, endemic communicable disease, nutrition, traveling, and allergy. We should put in mind also the psychological factor in this patient. Then this is followed by the local examination, which means an inspection, palpation. We should characterize well the oral ulcer regarding its site, the shape, the size, the depth, the edge, the floor, the discharge, the surrounding area, if there is tender knot or not. Okay? Very important is the associated bleeding or any discharge, previous discharge. What about relation of the deeper structure, what's surrounding the skin, and if there is regional lymphadenopathy. So what will we request of a case of oral ulcer? As we know, oral ulcer have diverse causes, but frequently show similar histological pattern. As we all know, that the complete thickness of the surface epithelium is lost. So we not depend only on the routine microscopic examination. It will always reveal the acute infiltration of cell in case of acute ulceration or chronic inflammatory cell in case of chronic ulceration, despite ان في بعض الحجاماتيس disease وعلى الشانكر and tuberculosis, sarcoid, والherpetic ulcers هتبقى ليها definite and produce tissue change which made it easy to reach the diagnosis. لكن في الحالة دي أنا بحتاج special staining to reach definitive diagnosis. The biopsy of non-healing ulcer is mandatory. Virus isolation and culture, rising antibody titer, and a lot of investigation may be requested as CBC, fasting blood glucose, iron, vitamin B12, celiac antibodies, fecal calprotectin, HIV, or syphilis etiology. In fact, what would we ask? That what you suspect. So when we suspect through the patient condition, history of present illness, examination, difficult to treat, and chronic oral ulcers. And as a gateway of gastrointestinal tract is oral cavity, we not surprising that many GIT disorders have oral manifestation. And I will highlight some of the gastrointestinal tract with just oral ulcer. One of the common GI disorder is the gastroesophageal reflux, improper relaxation of lower esophageal sphincter, reflux of the gastric content on the esophagus, producing esophageal and extraesophageal symptom. One of the extraesophageal symptom, the oral, the dental erosion, xerostomia, halitosis بسبب backflow of these gases and gastric content, mucositis, and recurrent abscess stomatitis like ulceration, sore taste, and burning mouth. What about peptic ulcer and Helicobacter pylori? Actually, we know all of peptic ulcers are very common between the patient population, and it's maybe gastric or duodenal, and the criminal beyond it is the H. pylori, which is not only causing peptic ulcer, but yes, it can cause chronic active gastritis or chronic atrophic gastritis and gastric carcinoma. We know that WHO have recognized as a human carcinogen. What about relation between Helicobacter pylori and oral cavity? Yes, it's a potential extra gastric reservoir for H. pylori. And actually H. pylori is transmitted, one of the methods of transmission is kissing, and have been isolated from saliva. And we have been established data about the association between H. pylori infection and recurrent abscess stomatitis. But it's a debatable point. But some researchers have found it's a transient, not a permanent reservoir. And a lot of meta-analysis have been established that H. pylori, yes, reservoir in oral cavity, and is a method of reinfection in patient. A lot of clinical trials support and reinforce that, especially the proper antibiotic therapy in patient with H. pylori positive and correction of any nutritional deficiency in this patient will heal the oral abscess stomatitis in this patient and decrease the number of episodes and relapse. الامريكان كولج اوف جاسترونترولوجي من حوالي اقل من شهرين نزلت الجايد لاينز اوف اتش بايلوري عشان انتم ما تتخضوش بس في العيادات تشوفوا تريتمنت جديده. استخدمنا البي كاب الدول اند تريبل ثيرابي. What about inflammatory bowel disease؟ طبعا حاجه من الميجا ستار diseases in GI. We all know that ulcerative Crohn's and ulcerative colitis and Crohn's have intestinal and extra-intestinal manifestation. And one extra-intestinal manifestation is abscess stomatitis and periodontitis. Actually, عشان نتكلم على oral lesions in Crohn's قسمناها in a non-specific lesion and a specific lesion. وactually oral abscess ulceration in Crohn's disease high percentage من 20 to 50% of the clinical presentation of oral ulcer. And it's of great help and very significant to diagnose a systemic Crohn's disease. That's what we all. Yes. I would like to highlight that recurrent abscess stomatitis in Crohn's not specific to the disease only. Yes, I could found this, but it may be in other several diseases as AIDS and celiac-based disease. Other non-specific oral finding, angular colitis, dysgeusia, glossitis, mucosal discoloration, periodontal involvement, and البايستوماتيتس فيجيتانز دي احنا بنشوفها اكتر في الالسيف كولايتس اكتر من الكرونز ديزيز. اشتغلنا نيشن وايد مالتي سنتريك ستادي ونشرناها في كيو 1 فورنتير ميديسين وكانت على كلينيكو ابيديميولوجيكال كاركترايزيشن اوف بيشنت اوف اي بي دي والحقيقه لقينا كانت السامبل سايت بتاعتنا 1100 و4 بيشنت كان ulcer colitis 897 لقينا فيهم 9 فيهم oral abscess ulceration والبيشنت الكرونز كان 207 منهم فقط 2 abscess stomatitis. Is this malabsorption? If the patient come to you with manifestation of malabsorption, chronic abdominal pain, chronic diarrhea, abdominal distension, nutritional deficiencies, if the patient has osteoporosis, has eruptic skin eruption, if patient have abnormal liver biochemical test, if the patient have anemia, you should suspect malabsorption and celiac disease, one of the rising diagnosed disease in the era now. Is associated with the mouth ulcers, inflammation of the gum, and the xerostomia والhalitosis. لكن بنحب نهايلايت برضك as a gastroenterologist على الرغم ان في association between recurrent abscess stomatitis والceliac disease، لكن حتى الان celiac screening is not well recommended حتى الان في اي عيان في abscess stomatitis على عكس الكرونز disease. لكن we should suspect it if the patient has oral ulcer with anemia or anemia related symptom. I always tell the residents, don't miss the monster, the hidden monster, the hidden ghost. That infection, we had very communicable systemic infection have oral ulceration على رأسهم herpes simplex is very common والدايليما بتاعته especially في immunocompromised patient ناس تاخد chemotherapy أو HIV وكلينيكال diagnosis is obtained. الكوازاكي فيروس خصوصا في الناس الchildren واليانج adult بتعمل ulcers في الاوروفارينكس والفوشس. الانفكشس مينيكلوزس ده عيان بيجي بفيفر سور ثروت lymphadenopathy splenomegaly and malaise بيعمل ulcerative and exudative tonsillar pharyngeal lesions. الجونوريا especially in subject practicing oral sex. Syphilis which is still endemic in Africa and North South Asia والحقيقة characteristic regions بتاعته تعمل superficial painless ulcer with white base and red margin cholestatic to form السنيل track أو mucus patch. هما بابيلوما فيروس بيكونوا مع الكانديزس ومع في HIV patient ودايما بتبقى affect اللبس. HIV broad spectrum oral manifestation منهم recurrent abscess ulceration that actually may be idiopathic or associated with an infection or a malignancy that occur in case of HIV/AIDS patient. This is TB. Yes, we found oral TB ulcers and actually the most common cited بيبقى affection بتاع الtongue maybe affect any part of the oral cavity in the form of ulcer, nodules, fissures, plaques, or vesicles وبيعمل papillary proliferation of the papillary gingival tissues. So we are not finished. I remind you that a broad spectrum of drugs can cause oral ulcers. Actually, these include all antibiotics classes, oral antifungal, antiviral, antiretroviral, antihypertensive drugs, in non-steroidal or immunosuppressive drugs, yes, can cause oral ulcers. Please suspect patient if has any nutritional deficiencies, multiple vitamin deficiencies, if the patient is anemic, yes, expecting this patient will have one day oral ulcers. With regard of systemic disease, lupus erythematosus, yes, we found oral and nasopharyngeal ulcer, usually painless observed by the physician, vaginal granulomatosis, oral or nasal inflammation, development of painful or painless oral ulcer, reactive arthritis, ulcers may be present, maybe not painful, Sjogren syndrome, dry oral mucosa, often present ulcer, sweet syndrome, and periodic fever, abscess ulcer, pharyngitis, cervical adenopathy. Cyclical neutropenia as present with abscess ulcer type ulceration which occur at interval usually 3 weeks or often monthly, fever, malaise, mucosa ulceration and occasional abdominal discomfort. الماجيك syndrome اللي هي mouth and genital ulcer with inflamed cartilage syndrome. This is overlapping with the basic disease اللي حضراتكم بتشخصوه لنا. تمام as a systemic inflammatory disease, variable vessel vasculitis affect arteria and venous vessels. Actually, it can affect many systems, recurrent mucocutaneous lesions, affect has a neurological and vascular and gastrointestinal manifestation. اشتغلنا 3 حالات قبل كده في الكونوسكوبي، الحالات دي انا اشتغلتها، كانت حالات جايه بجي اي تي مانيفستيشن ودايجنوز، وكانوا فاكرين ان دي يعني حاجه unrelated، واحنا طبعا يعني ده very proper and right thinking ان ممكن العيان بيكون عنده اكتر من etiology ويكون عنده مشكله في الكولوم زائد، بس احنا لازم نكون متوقعين ان عيان زي ده هيكون عنده intestinal lesions، واحنا فعلا شفنا في عنده intestinal ulceration وكان عنده chronic ulceration. Recurrent ulcer stomatitis is a major sign here. Besides, another major manifestation is the genital ulcers. Besides, the other manifestation of Behçet disease are the papilopustular lesion, which resemble acne, ordinary acne, and erythema nodosum-like lesion over a lower limb. Home tech message: there are numerous causes of oral ulcer, and the diagnosis process involves scanning of all systems with improvement of the clinical evaluation that will further provide us accurate guidance. The MD team consultation should be expanded in practice. This is my reference. This is my contact data for future collaboration. Thank you.